And here is your question. All right, so if you have read and understood, considering the communication skills station, kindly please begin.
Hello, I'm the SHO, one of the surgical doctors here. Are you the mother of the 10-year-old girl that had been approached here by her teacher from school?
Yes, I am.
Okay, I was told to speak to you about your child condition. First of all, can you tell me what's your apprehension about this, please?
I was told that she was brought with some pains. I was away, and they told me on my phone, and I feel guilty that I wasn't was here at that time. Is everything okay?
First of all, let me assure you and tell you that your child is in a good hands right now. And let me also describe the situation for you. And I don't want you to be guilty, because this can happen anywhere and anytime. Anytime, and let me tell you that your daughter has been brought to us, to the emergency department, by her teacher from school. She had a tummy pain. Our initial investigation revealed that she had something called acute appendicitis, which is an inflammation in some organ inside her tummy, in her right lower side of her tummy. We managed her immediately when she got out to our hospital by giving her fluids and antibiotics, and we are now waiting for our consultant, Mr. Laid, because he is the consultant who will operate upon her.
Are you sure about this diagnosis, doctor?
Okay, we cannot make sure 100% for this diagnosis, but our initial clinical assessment and our investigations and all the clinical signs and symptoms are more likely to be this thing which is called acute appendicitis, and we only will be sure when we operate upon her.
Is there any danger for her?
Okay, let me first tell you that we hope she will be okay, and let me tell you that in children specifically, there is less fat inside their abdomen. So if the acute appendicitis perforates, it might be yes dangerous, because it might disseminate in her body. But now she is in our care, and we need to operate upon her to make it better.
Will this affect her childbearing, doctor?
Sorry?
Will this affect her childbearing?
Okay, let me tell you that if this occurs and this appendix affect her left her left tube, which allows her to get pregnant, it might not be a problem, because her other side has also has also a tube for which she can she can be pregnant upon it.
Okay, what about the scar? It will be leave a big scar?
Actually, in our operation, we will do a small scar with lines of the tummy, and it will leave definitely a scar. But a small scar. But if we need intraoperatively to extend our scar for the sake of your child, we will do it.
Okay. Thank you, doctor.
No, ask who will be operating on my child. Would you be operating?
Okay, no, I'm not. No, I'm not the one who will operate upon your child, Mr. We are waiting for Mr. Ladd, who is the consultant, and he will operate upon her.
Okay.
No, not Mr. Ladd. He was the one surgeon who killed my husband last year. No, absolutely no, doctor. Cannot
Yeah,
operate on my
I'm
child.
so Yes, I'm so sorry to hear. I'm so sorry for you to hear this, and please accept my sincere condolences. May I ask you? When and how he died?
Last year he died. He had a colon cancer, and Dr. Ladd, he operated on him. But unfortunately, my husband could not survive because of his poor operational skills.
Yes, I'm so sorry for you to hear this again. But let me describe for you something. Your husband had cancer, and he might died because of the cancer itself, not because of the operation. And let me tell you that Mr. Ladd is a professional consultant. He has done many of cancer surgeries, and also surgeries for acute appendicitis many times before. And I need you to be assured and not to be afraid at all.
No. That's really unacceptable. What if he'll kill my daughter as well? She's the only child I have.
No, I'm really sorry for you, and I can understand your frustration and your fears. But let me tell you again, acute appendicitis is completely different from cancer. This is inflammation inside a certain part of hair bowel. And the operation will include removal of this part, and then the patient, if he is not complicated, he became good, and nothing will happen to him. But the cancer, you know that cancer is very dangerous, and patients might die from cancer itself without any surgeries at all. So it's totally completely different, and I need you to be calm, and to let your daughter to have the operation, because she is in a need for it, for not going for any complication.
Okay, what paper do I have to sign? I trust you now.
Okay, you have to sign a legal document which entails the exact condition of your child, and that we are, and the operations that we are going to do for her. And also it entails the complications that might occur upon it, and if you accept it, we will go for operation.
Okay. Then you can thank the mother, and you can make her sign and leave the number if she has any question.
Okay. Many thanks for you, and Miss, we can let's summarize what we have been through. Your child has acute appendicitis, which inflammation inside a part of her bowel, and upon which we need we give her fluids and antibiotics, and we are waiting for our consultant, Mr. Ladd, to operate upon her. And you understand the situation, and you accepted to sign a legal document accepting to be operated upon, and also accepting any complication might occur. And I need you to know that we are all here to help you and to give you a hand. And if anytime you have any inquiries, don't hesitate to contact me, and I will leave my number with the nurse. And thank you for your patience and convenience.
Good. Thank you.